let's talk now practically, right? What are the actions that community health centers can be doing right now to prioritize? Um, and how I think of it is along multiple levels, right? Policy advocacy, what are things we can do from an operational standpoint? What we can do from a revenue diversification standpoint or a revenue preservation standpoint. And then also very deeply important is from a community health and health equity standpoint. Obviously, a lot of the things that we were talking about were upfront policy and advocacy. But Joe, anything more that you wanted to add there on what else we can do there on the advocacy front? And what is already, do we feel is fully defined or potentially subject to change prior to the rollout in 27?
Yeah, so I think one of the first things that all health centers could do is think through and look back at what you did during the Medicaid unwinding process, right? As part of the COVID pandemic, there was, the states received extra funding, and because of that, they were not able to redetermine eligibility, and so right that eventually stopped, and there was this massive redetermination process that all played out, right? We're all familiar with that. That is an example where we could think back to, okay, what happened in that scenario? And then, are there relationships that maybe you developed with the health plans that you could go back to, or you could, strengthen again and refresh to understand what it is, how this new environment, especially with the community engagement work requirements, that you could lean back on that, right? Are there other things that you could be doing? Other partnerships. Again, like I mentioned, the Medicaid agencies. There's going to be a significant number of new state administrative requirements that are going to be placed on them. So, is there a way that through those connections and communications, that health centers could be seen as a solution for the state Medicaid agency, and assist them in this process to build that goodwill, but also that opportunity maybe for future funding as well, right? And so those are some of the ideas that kind of immediately jump to mind. But then also looking at your own internal patient population, I think is going to be important to kind of scale what the impact could be for you, and having that connection also with your other community-based providers in your community, right? Are there other organizations that you may have similar patient population that may also be included? There was a number of SNAP changes, for example, in the law and other kind of social programs. So, is there connections that you could be building right now that would pay off as these things start to play out?